Hello, everyone. Welcome back to the Functionally Enlightened podcast. Today, we're thrilled to have a very special guest, Deanna Hansen. Deanna is a true pioneer in the field of fascia decompression, and her work has transformed countless lives. With over 2 decades of clinical experience, she's developed unique techniques like fluid isometrics and block therapy, both of which are trademarked. And these therapies can help relieve chronic pain, improve physical function, and even reverse the aging process. Deanna is a best-selling author and a sought-after teacher sharing her expertise on fascia decompression and its benefits for physical, mental, and emotional health, which are pillars and absolutely fundamental concepts to address in all cases. So in today's episode, we'll delve into the fascinating world of fascia and explore how these simple yet powerful techniques can help you feel better, move better, and live better. Welcome, Deanna. We're so excited to have you here today, especially knowing you have such a vast knowledge in abdominal issues resulting from things even like hernias and post-operative pain that seems to pop up, I would say, almost 100% of the time when people have these type of surgeries. So can you please start by sharing with us what brought you into the functional space and what exactly is fascia?
Thank you, first of all, so much for having me. I'm very, very excited to be here sharing with your community. So my world began in fascia began when I was 30. So I'm 55 years old now. And so for the last 25 years, I've really dove in. And it started for me because I was trained as an athletic therapist, and I was always working on my patients doing deep tissue work. And I had a really good, strong clientele because I had good, strong hands, but my own body was struggling. I was 50 pounds overweight, struggling with anxiety, depression, chronic pain. And the harder I was working to get my body into a healthy space, the worse I became. I would get more compressed, more toxic, more constipated. And I mean, just my depression was really negative at the time. So at the age of 30, I made a couple of changes in my life. And these changes actually resulted in me having severe anxiety attacks. But it was this one attack in particular that was the seed of everything to come. In that moment, I thought I was actually going to die because I was so locked and frozen in fear. So for some reason, I intuitively dove my hand into my abdomen. And this was the area where I stored the majority of my weight. So I never touched that area, let alone let anyone else touch it. So now I'm moving my hands intuitively in this tissue. And what I sensed under my fingertips was what felt like scar tissue marbled throughout, even though I hadn't had any injury or surgery in that space. Another thing that happened when I put my hand in there was I experienced pain, but the pain actually brought me out of my crazy thinking. It brought me back to my body and made me realize, okay, I'm going to live another day. So as I intuitively explored, I just had this amazing sense of peace. So I spent about 30, 45 minutes just doing this. And then when I stood up, I felt really calm, which was not my norm. Woke up the next day, went and I worked full day on patients, excited to get home that next evening to do the same thing. And after I did that, when I stood up, I felt taller. And I went and I looked at myself in the mirror, and my belly was flatter than it had looked in years. And I mean, I worked hard. I ran, I did Tai Bo, 400 sit-ups a day. I mean, you name it, and I was doing the work. And I just kept getting more compressed and more ballooned and more toxic. So for only 2 days, literally at my fingertips of doing this work and seeing a change, that became my new process. I'd come home from work, and every evening I would work on myself. And within 2 weeks, my chronic low back pain was going away. I had all these other just feelings of lightness. So I started flipping my patients onto their backs and working in a similar way in their bodies. And I started having just incredible changes. And then I started attracting therapists to learn this technique. And it was a couple of years in that I really recognized, like, I'm actually working in the fascia. Before, I mean, as an athletic therapist trained, we're working on muscles and tendons and ligaments and all of those things. But then as I was understanding what my hands were intuitively doing, I recognized I was in a different layer of tissue. And so that was how this whole journey began. And that was 25 years ago. So, I mean, it's been just a fascinating journey to really uncover and identify what fascia is. And the way that I see it is literally the surface membrane of every cell connected to every other cell in the body. And it's the communication system between all cells. And fascia is made up primarily of collagen and elastin. And when there's a balance of these two proteins, we have both mobility in the body, also stability. We've got a structure. And when healthy and aligned, what it does is it allows optimal space in and around every cell. Space allows for ease of nutrients to move into the cell, as well as the removal of toxins and debris away from the cell. So in a perfectly spacious, healthy body, there's optimal flow. And as long as there's flow, we're good. The challenge is we are under this constant force of gravity. So we're constantly compressing down toward the earth, but we don't just compress linearly. We're dominant on one side of the body. So we overuse the body on one side, underuse on the other. So we literally spiral down in one direction or another, which is aging. We basically get shorter and wider as we get older. But in relation specific to hernias, understanding about this internal pressure, and the more pressure we have on the inside of the body, now we have the contents of the inside coming through the tissue, creating things like inguinal hernias, hiatal hernias, umbilical hernias, all of these things. And it's really understanding how this pressure inside is the culprit for the hernia. And then what can we do to it by addressing the fascia?
I wonder if there's anything that would trigger the desire for someone to want to work with fascia if they know, like, how would they know they might be susceptible to developing a hernia? Are there any symptoms or signs that they have some abdominal weakness?
That's actually a great question. And I mean, really, I think anybody is susceptible to developing one, because really so the world of fascia decompression that I live in, there's three pillars. So the first pillar of fascia decompression is to create the space, putting the space back in the body that time has taken away by going backward through time in your tissue. The second pillar is the key. It's really teaching people how to breathe diaphragmatically. And this is what we need to understand, because pain, fear, and cause us to reactively hold the breath. So the majority of the people in the world are breathing through the muscles of the upper chest. This is the challenge, though, because that's not the breath that we should be using all the time. So I'm just going to take my camera down just so I can show a little bit of a demonstration here.
Perfect.
So the diaphragm is this plate of muscle that supports everything above the rib cage. When it's strong, when we inhale, it moves down. When we exhale, it lifts. The action of this muscle is giving the abdominal organs, the heart, the lungs, a continual massage. Now, if we aren't conscious breathers, and unless you are, you're not, this muscle becomes weak. And over time, what happens is the weight of everything above comes crashing down into that core space, causing this movement of tissue outward. So if we don't have that strong diaphragmatic breath, first of all, we're really starving the cells for oxygen. And oxygen is the key, of course, for all the cells to thrive. So we feed the body up to 6 times the oxygen when we breathe diaphragmatically. But secondly, they've shown in research that 84% of weight loss comes through proper exhalation. So if we're breathing shallow and short, then we're keeping all of these toxins in the body, which is adding more and more pressure, because the more toxic we are, think of pollution, those pollution bubbles, like the more there is, the bigger those bubbles get. And then if we're toxic, now we're also attracting other things, bacteria, fungi, parasites, whatever they may be. Waste gets created from their metabolic functions. So then we continue to expand. So we end up with this body that becomes very tight, very rigid, and very dense and heavy inside. So anybody that isn't breathing diaphragmatically, in my opinion, has a potential for a hernia. But it's also understanding, and this is the third pillar of block therapy, the second one being inflating the space through the breath. The third one being maintaining that space through understanding proper postural foundation. So if we don't use our body the way it's intended and also support those foundations, then we allow everything to collapse, and then we balloon, and then that impacts what's going on inside the abdomen and everywhere in the body, in fact.
That's true. And what you capitalized on is the postural alignment piece and the breathing. I know I didn't really learn the essence of the correct form of breathing until after my surgeries, which was, a little bit too late. Like I wish the knowledge should have been there, or even just the advocacy. I should have advocated more for myself and for the knowledge of, yeah, I have a hernia. What was the cause? Oh, just the pregnancy. That's all I was told. The pregnancy, I developed an umbilical hernia, and then I had a cesarean, so I developed an incisional hernia. And these things, multiple surgeries, still the physical therapy that I went through for years and years, it helped with some of the posture alignment, but it didn't help navigate the chronic pain piece in the, what's the word, the stuck feeling. So um, what would your plan be for someone like myself who's undergone multiple surgeries and has the adhesions restricting them? And even like in the posture, when you're talking about posture, I know that I'm hunching over, my shoulders are rounded and my head is forward.
Yeah. So coming back to the contents of fascia being collagen and elastin. So again, when they're balanced, we are balanced and we have that space. But what happens when we start falling out of alignment? The collagen component of the fascia migrates. It migrates to create stability and structure where it's needed. So we don't literally fall on our face, because if we're not standing with equal weight on both feet and we start to tip over, the body has to adapt so that we don't literally fall. So these adhesions form gradually over time, creating a slower flowing body, a colder body. And so basically, whether it's scar tissue from injury or surgery or adhesions, they all act the same. They're blocking that flow. It's like barricades. But the reality is they're frozen. So what we want to do is we want to heat up the body. So when we breathe through the muscles of the upper chest, our body is very, very cold. We're not activating that energy in the body. It's kind of like if you had, I live in a 30-story building, and in Winnipeg, it can be minus 30 Celsius in the winter. It can be very, very cold. If I only have one space heater, I can heat one room in my apartment. If you turn on the building's furnace, you heat the entire building. Your diaphragm is your body's furnace. The upper chest muscles are like a space heater. So they're very weak in comparison and can't heat the body in its, like the whole, sorry, it can't get blood flow and oxygen to all of the cells in the body. So then the body starts shutting down essentially. Think of blowing up a balloon. When it's fully blown up, it's round, it glows, it almost defies gravity. When you take half the air out of the balloon, it becomes wrinkled, it attracts dirt and debris in the creases, and it becomes heavy and dense. So if we're not breathing properly over time, more and more cells become deflated and heavy and dense and sticky. And then fascia adhesions will grip and adhere to anything in its path, including bone, with a force of up to 2,000 pounds per square inch. And that's where that stuck feeling really comes from, because we're literally magnetically sealed in this alignment. So to say, if you've been slouched for, 2 decades in front of your computer and somebody says, sit up straight, you might be able to do it for a moment, but that magnetic seal is going to pull you right back down. So what fascia decompression is all about, it's all about creating space, that first pillar, through the process of melting scar tissue, melting adhesions through pressure over time, combined with proper breath. And then we teach you, we don't roll or move on the surface. We sink in and then allow that pressure to create heat. And then we slowly teach you how to shear through those layers of fascia so that you can get to the root of the problem, which is at the bone. And we use a tool, if I may share what it looks like. Is that okay?
Of course.
Yeah, Block Buddy. It's made of wood. These are made from elm. And the reason they're made from wood is because bone and wood are similar in density. So if we used something porous, for example, like a fascia roller made from plastic, and you rest your body on it, because it's porous, you'll affect a couple of layers of the fascia, but you're not going to go through all of those layers to get to the root of the issue. So the combination of pressure over time, combined with the instruction of how to breathe diaphragmatically, now you're heating the body on the external part as well as from the internal aspect. So it becomes really effective at melting through those adhesions. And then with that breath work, now we're pumping blood and oxygen into these newly created spaces. So those cells that have been blocked, they start waking up, they start taking that oxygen and start becoming integrated for function again. And then the third pillar, again, is understanding how to keep that body in that correct alignment so we don't just slump back into those negative patterns.
And that brings up a few questions. One of them I'll come back to. But as we look at people who have active hernias without repair, say maybe they're putting it off out of fear or the discomfort piece, they don't want mesh. They've already heard the news about mesh, and that's great because a lot of people are suffering with implant illness now, especially because of the material. And what kind of wood did you mention it was, the block?
These were made of elm now. Yes.
Okay, and I liked when you brought up that it's not made out of plastic because we know plastic is toxic and estrogenic compounds. But going to people who might have fear to implement a routine or go to a practitioner such as yourself, how would you explain to them that it's not going to cause any other discomfort? It's not going to enlarge the hernia. How can you assuage their fear?
So the first thing is we always start with block therapy in the belly position. So we have people actually lying on this right at the belly button, and we teach people how to breathe. Now, if we have, say, a hiatal hernia and we like the whole tissue is open and it's too painful, then we instruct you first to lie on your back, simply place the block on the belly, and then learn where the breath should come from. But then more importantly, what we would guide you to do, this area through here, this armpit area, this is such an important area because when we lose that diaphragmatic connection and we start falling in, the shoulder blades, they migrate around the rib cage. And then the underborder of the shoulder blade adheres to the ribs, locking us into this very top heavy position. So when we can just take a little time and release this part, it brings the rib cage up and back. And as soon as we start decompressing, then that hernia starts to come back together because it's the pressure that's causing everything to move from the inside toward the outside. So we need to decompress. Now, we also want to understand how our lower body alignment also impacts this. Whenever I look at a body, I always look at, there's going to be one foot that's going to act like a flat tire, drawing the body away from alignment. And then the opposite side of the body is going to anchor so that, again, we don't fall on our face. And that's that collagen migration. So what we want to also see is, how do we bring the feet back to balance? Because if my feet are out of alignment, then my hips in my pelvis have also migrated. And that migration is putting immense pressure and stress to the pelvis, which is adding even more ballooning to the abdomen. So there's so many things that we can do simply by understanding how to release these adhesion patterns and rebuild correct alignment without even having to necessarily go into the space where we're afraid of. And then as we do this work at a bit of a distance, then we start decompressing in the abdomen, and then you're going to start to see changes. And then you'll get to that point where it's like, okay, I can try this now. And then as we start lying on it, because of that heat, that helps to melt the adhesions, melt the scar tissue. And the body wants to be right. The cells know where they're supposed to be. We just have to get rid of the scar tissue that's blocking their energy connection.
Right, right. It's an innate intelligence that the body has. And, going to what you're saying, I wonder about time frames where people could expect to see some type of improvement. And I imagine it's making perfect sense to me now with the adhesions and the malalignment of the body, how you have impacts to your hormones and to just having neurological symptoms that result. A lot of people are now being diagnosed with dysautonomia, and with that, they have blood pressure dysregulation, other things, tachycardia. So the lightheadedness, brain fog, all these things where it could be a structural thing that doesn't require surgery. And as you said, if they can begin at a like taking a step back and working on the diaphragmatic breathing, that's a piece that can also apply to the mental, emotional, spiritual connection, and just trying to unplug from the pain that they typically are feeling on a day-to-day. So now we talked a little bit about people pre-surgery. What about those people who have gone through surgeries and, multiple surgeries at that, or maybe they've had one and their doctors have recommended that they do weights as normal or exercise as normal, but without any proper guidance?
Yeah, and that's such a great question because exercise, the word exercise sounds like it's a positive thing, but if we exercise without conscious awareness, then that can cause problems, because if I'm walking, but I'm walking out of alignment, I'm actually supporting that negative alignment. And the harder that I work, the faster the descent of the body. In my opinion, doing weights is probably one of the most negative things from the perspective of exercise, because most people really don't understand how to be in correct alignment when you're pumping weights. And as you're doing it, you're basically strengthening your body further and further and further out of alignment. So we want to be active in our bodies, but the process of, say, yoga and Pilates, as well as what we teach, is all about lengthening and strengthening muscles. Doing weights is shortening and making the muscles denser. The whole concept of a hard body, that's not a good thing. You know, like the muscle, when contracted, we want it to feel nice and firm, but when it's relaxed, it shouldn't be hard. It should be soft. You know, like we should have space between for flow. As soon as something gets really dense and hard, then it's a problem. And I have so many women, which is really interesting because like I do so many assessments on bodies, and there's a lot of women that have very tight, what looks like toned legs, but then they balloon in their upper body, because there's so much fascia tension. It's like you're squeezing that, you know, balloon on one side, and then there's this ballooning up here. So I always share, your real issues are coming from your calves and your feet, or your legs. And I've had so many of them say, but that's my best feature. They're so hard. And it's like, but they're not hard in a healthy way. You know, there's so many adhesions that have gripped to bone that to even palpate it, it feels like concrete. That means no flow. There's no flow getting to the cells in your feet, your calves, and then the way that they're bound, they're going to be bound asymmetrically, and that's going to keep pulling you up the chain, twisting you further and further out of alignment, causing more compression, more inner tension. So exercise, what we want to understand is we want to be healthy and then fit. We don't want to be fit first, because if we don't have the health of the fascia, which basically we were born to breathe a certain way, but we've lost that art. So this teaches us how to get back to that art so that we can actually support the cells, and it's all about the space.
And with a focus on the legs, which, as you said, nobody really thinks that the adhesions are there or you're getting bound up by the legs. But would you think that that is something that contributes to the vascular problems where people are experiencing neuropathies of the feet?
Yes, completely. If you'd like, I can show everybody right now a really, really simple exercise that you can all do right away, every day, and this is going to create change.
Yeah,
Would you
that'd
like?
be amazing. Yes, I'm sure our audience wants to see it.
Great. And the reason I'm sharing this is because the toes are literally the furthest part of the body from the engine. So when we're breathing incorrectly, your toes are the most frozen, and the toes are like the eyes of the feet. The toes are supposed to be integrated into how we walk and how we move. Yet when we start collapsing, you know, under the weight of our bodies over a lifetime, the feet deflate. Essentially, they get spread out and they twist, and then the toes will lock the entire fascia patterning up the entire body. So what you would do, and you can use either a pencil or you can use a finger, put pressure between each toe for 3 minutes as you focus on your exhale. You want to exhale for a little longer than you want to inhale, and you always want to breathe in and out through the nose. So we hold, you feel pain, and believe me, it doesn't take much to feel pain between the toes. 3 minutes between each toe, you're going to start to release that negative patterning. And then after you've done that, then stand in front of a mirror with your feet together, feet pointing forward, and slightly bend the knees, because most people hyperextend at their knees, and the knees are the levers of the lower body. And so if we don't have connection to the knees, then we're not actually using our muscles to hold up our body weight. We're asking those ligaments to support our weight. And then we take away the joint space, which down the road is going to lead to arthritis. So when we grip the toes, we hold for 10 breaths, and it's like we're pumping up the tires. So then the feet gain life, gain spring, and we start getting energy from the feet, combining that with the breath, and then we start bringing the body back to life. There's a saying, death starts in the feet, and there's a reason for that. It's because it's in the Arctic, essentially. So we want to keep the whole body equally heated, and we can't do that with the incorrect breath. And we can also not do that with adhesions riddled throughout. So this whole process is about, again, melting those adhesions. But if we start with just the feet and the hands, so I'm just going to show you one more trick, because I always say that the limbs are the puppet masters of the core. So if we've got issues in the core of our body, whatever they are, the limbs are going to be the reason. So we can also release the hands. So putting just between here for 3 minutes and holding, and then 3 minutes and holding, but I would do it more like at belly button height, so you're not all jacked up. But again, there's a lot of pain in there, but your breath is your guide. This is the one thing we always teach you. As long as you're breathing in a relaxed way, you're feeding and healing your cells. if you do something that takes that relaxed breath away, that's your body saying that's too intense for me. Back off a little bit.
Mm-hmm.
So through the process of understanding your breath being your guide, in this, we can also understand our breath in external situations. For example, if you and I are having an argument, or I'm feeling uncomfortable around you, my breath is going to give me those signals. It's going to, like, I'm going to be, breathing fast. It's giving me this information that my body doesn't feel safe right now. So teaching you how to use your breath, not only in this practice, it also gives you so much information about your life in general. Maybe there's a friend that you always feel anxious around. That's your body giving you a signal.
Mm-hmm. Yeah, the energy is off. So I'm assuming when we're doing these practices, and I know I'm going to start implementing that today, we can expect to feel some discomfort, and it's okay to push ourselves to a certain extent, but you said we should know when to back off. Now, following any of these practices, even if we just start with the feet and the hands and doing the bend for the 10 breaths that you just mentioned, do you see that anyone, even especially people who are limited in mobility, do they feel more discomfort after the fact, or what can they expect?
What can happen? And it's amazing because I have all these YouTube videos showing this, and I have had so many people reaching out just from doing the breath work and the toe and the finger work. I had one woman whose neuropathy in her hands went away, and then she said her hair stopped falling out. I've had other people say that, their pain has improved immensely. Whenever we're doing decompression work, what we're doing is we're disrupting the current energy situation. So sometimes healing crises can occur, but that's your body responding, and that's a good thing, even though it might not feel good in the moment. So as soon as we start changing our entire alignment from our foundation, now we start walking differently. So then you might end up with a little bit of knee pain, or suddenly your hip is sore because now you're activating parts of your joints that haven't been touched for a long time. But that's your body waking up. And inflammation, there's all this talk about how inflammation is the problem. It's not the problem. It's the response to the adhesion in the scar tissue. The problem comes when we don't know how to support the inflammation.
Right.
But if we support it properly, then it rebuilds the tissue, as opposed to allowing the body to heal with scar tissue. So just like, for example, if you have a sprained ankle, the first thing that the body is going to do, it's going to direct blood flow to that area filled with healing proteins and oxygen to rebuild. But we've been trained for, I don't know how long, a long time, to ice.
Right.
For 48, 72 hours, the rice method. Let's slow down that inflammation. That is not what we want to do, because now we have this gap, this open tear, something, fracture bone. It's all the same thing. It's a gap in the system. The body knows how to heal, but if we ice it, think of baking a cake. You have your raw ingredients, your oil, your butter, whatever, your flour. You mix it up and you have batter. If you put batter in the freezer, you have frozen batter. If you put batter in the oven, you bake cake. So the body knows how to rebuild itself, but we need to support the inflammation through adding energy, not taking energy away. And we can add energy through heat, through breath, through movement, with the breath being the guide, and then through fascia decompression techniques.
Yeah, that's so important too, because even my own child who suffered sprained ankles, and you try to do the right thing and you bind it up and you do the icing, but we do want the motion, like you said. There's inflammation there for a reason, but I guess the problem comes when the inflammation doesn't resolve, as the case with uh, what we call Asia syndrome. Like there's always this autoimmune inflammatory response happening. And that can happen even with the arms, legs, any injury, if we don't properly do the healing or have the right guidance. Like there's a lot of well-meaning doctors who are not specialists in that specific, body part, organ group. And so we rely on them. But in your expertise, in your practice, I know I've read one of your book, your Unblock Your Body, which is very good and very practical, a lot of information in here. And, I'm trying to apply it to more than just myself and my clients and even my children. But is there anything you can give to people when they have an acute injury? Like, what should they be doing?
And that's a great question. And that's super dependent, first of all, on where the injury is. So
Right.
the first thing we want to do is we want to make sure that we're breathing, because now you have this need for the body to send repair. So the breath is how we direct that repair. So even if you have a broken ankle, we can work the rib cage, we can work the abdomen, we can get that breath nice and strong. And the stronger the breath, the faster the body heals. We turn ourselves into our own healing machine when we have breath. Another thing is, again, if it's at a distance, like let's say it's the foot that we've injured, we want to open those channels for flow. So with the work that we do, we teach you how to decompress everywhere in the body. And whenever we start our program, we always first start in the core and the rib cage to teach you to breathe. Then we start working through the legs to open the channels of adhesions that have formed over time all the way through the legs. And if it's, say, even a first or second degree ankle sprain, often after people just do one class of my lower body work, they've improved 70, 80% because the body is so quick to heal if we get at it right away, because it's open and it's ready and we've got all this energy. So if we know what to do with that, then it's at how quickly we can heal. Now, of course, if we have like a really severe fracture or something, there's different situations, but your breath is always something that you can do. And just to know if you're breathing properly or not, and most people aren't breathing properly, if you're lying on your back and place your hand on your belly should rise with the inhale and fall with the exhale. Most people, you'll see the chest moving. We don't want the chest to be moving when we're in a relaxed breathing state. We want the chest to stay nice and calm, and we want all that activity coming from the belly. So we have so many videos where we just teach people how to breathe, and it's so simple. You can use a rolled up towel, a hardcover book, and as long as it feels right for you to do, all you would do is you would lie right on the belly button on the tool, whatever it happens to be. And as you inhale, you want to inhale into what you're leaning on. And then as you exhale, you want to squeeze the belly small. And if we exhale for a longer count than what we inhale, then we're really tapping in to turning on the parasympathetic nervous system, the vagus. And we don't heal unless we're in the parasympathetic state. So just changing the course of breath is a massive way that we can support acute injury, no matter what it is, and no matter where it is and how dramatic it is. If I may share a quick story, she's one of my teachers now. She had started doing block therapy and got rid of 20 years of chronic pain. And she's in her 60s. And then she went sledding, and on a sled, ran into an ice wall, like 80 miles an hour, horrible fracture of her femur, broken ribs, concussion, broken wrist, it was just awful. I have a YouTube video interviewing Lisa about this whole thing and the process we went to. She phoned me from the hospital. It happened to be COVID as well. So now she's all alone. She has her block. And she said, she was in so much pain, especially the wrist. Of all the things she had, this nerve pain was the worst thing for her. But she got through it because she had already learned how to breathe. They didn't think she was ever going to walk again. She walks without a limp now because we got on calls once a week and I showed her what to do with the block. And she was a wonderful, consistent blocker. And she's healed her body. What she has accomplished is absolutely phenomenal. And, again, in her 60s, so not a 20-year-old who had this injury, somebody later, but put the time in and learn how to support the fascia. And the body's ability to regenerate when we know how to breathe is absolutely phenomenal.
Right. And I would imagine that people are bringing in other lifestyle changes too. Maybe they're more in tuned with their diet and just like the exercise, the stress reduction. What you're doing with your patients or your clients is stress reduction, even though maybe they're fearful in the beginning. But it seems like it's very, very doable. And I know I've gotten a lot of hope from listening to you, just dealing with my own pain journey. It took 4 years before I started functional movement, we'll say. I was bedbound for maybe 5 or so months before, and this was all from just a hernia repair surgery that should have been very benign, and I should have been back to work within 2 or 3 weeks. But obviously, there was a lot more going on with the mesh itself and the foreign body reaction. But now I'm thinking back, there was probably a lot of internal trauma to the body in general, just the course of how I lived my life, and I did not prioritize breathing and relaxation and the parasympathetic. So a lot of things like that. I think our audience might have had similar like lifespans where they're always trying to attain the next level of something. But I feel like when you're more in tune with your body and you reach out to a practitioner such as yourself, you really need to kind of take a step back, slow down, and feel everything. Like, does that make sense? Like, you have to feel all of the restrictions and movement that you're working through.
Yes, but the really exciting thing about this is the pressure fibers in the body are larger than the pain fibers. So that's what we really teach is we aren't adding pain through the process. What we're doing is we're connecting you to the deeper pain than what you're consciously aware of, so we can surface it and we can allow it to leave the body. And so that initial moment when you're allowing that block to sink in, and again, you're in control. So I mean, we don't just like it's not a forceful thing. Everything is slow. We hold positions for a minimum of 3 minutes. We're moving very, very slowly as we guide you to breathe. So it's all under your control, and you can do it lying in bed. And it's all done lying down. We do have some chair classes as well, but that's the nice thing. As soon as you take the control, and then you learn that your breath is your guide, you navigate the process yourself. And very quickly, when you're in a position, you start to feel, wow, okay, initially there was that pain, but hey, now it's changed because those pressure fibers are kicking in and it becomes a good pain. And then people want to seek more because the results are fast. You know, as soon as we especially that first class that we always share, where we teach you how to lift that rib cage up and get that breath working, immediately people feel lighter. They can sense that they're sitting up taller and they don't have to work so hard to sit up taller. And also when we connect to the diaphragm, it connects us to a relaxed brain frequency compared to up here, we're in a stress brain frequency. So we can be in a completely safe space, but if our breath is up here in our body, we're in stress mode. And conversely, we can be in a very stressful situation, but if we have control of our diaphragm, our internal world will be relaxed because it knows how to navigate itself through that breath.
And they're engaging all of their body too. It's not just one generalized area. They're not treating one specific part.
Yes.
Okay.
Yeah, we work head to toe. We've got classes for every single part of the body. And then again, between the toes and the fingers, it's kind of magical when you do that. And that's again, for the viewers, like you can start that right now and just feel that. But again, you want to stay for that 3 minutes because you can't rush melting. If you think of a big ice block, if I have this big block of ice and a butterfly in the center of it, and I put my hands on it and I do this, my hands will burn. If I just let my hands settle in, eventually the ice takes my hands and then the block of ice starts to melt. So that's kind of the process here. And if there was that butterfly in the center of this and you took an ice pick to get to it, you're probably going to damage the butterfly. But if you take your hands and you slowly melt the ice, there's the butterfly and it's not damaged. So it's a safe process. Now, having said that, healing crises are real though. As soon as you put positive energy in the body, the negative stuff has to go somewhere and it's going to come out. And it can come out through the skin. It can come out through, diarrhea, more bleeding, mucus production, tears, emotional releases, change in pain. Like these are all things to expect, but that's your body doing what it needs to do. You can't disrupt something and not have, some repercussion. I don't like using that word though, because it sounds negative, but it's not. It's just the response.
And a lot of that is part of the detox process. So sometimes you have to think of it as a short-term process that's getting you to the goal. And when, I don't work with clients manually, everything is done through, analyzing labs and looking at diet, lifestyle. And then I recommend people to see practitioners depending on what their needs are. So I know everyone would benefit from doing block therapy. Like I can't think of any exclusion because even the people who are like myself with bed bound, there's different exercises they can do from bed or with assistance from someone else. So for all of the audience, like what kinds of programs are available for them? And if you could take us through someone who might be bed bound versus someone who is post-op and they're starting to get back into functional life, but not necessarily where they were prior to surgery.
So great question. And I love this because we have a starter program that, you get the tool with it. And there's 12 classes in the starter program, and they're done in a sequential order that makes sense for opening up the body first, teaching the breath, and then working through all the parts of the body. And the nice thing is, whether you are an elite athlete and really healthy or you're bed bound, it's the same work. Your breath is your guide. You go to the level that you're going to go to. Think if you're in a yoga class and your goal is, I'm going to do the splits. You're going to go from wherever you're starting and you're going to slowly work your way toward it.
Mm-hmm.
And then that's the same as this process. You put that block underneath the belly, you start to breathe. If that's too intense, you lie on your back and you add pressure with your hands. This is all demonstrated in our classes. And you go with what makes sense for you. And then as you start melting those adhesions, the next day I'd be like, you know what, I'm going to try lying on it. Okay, I can handle this. And then it's this sequential process that you just apply to your own self. So some people dive into our program and they can go through it really quickly. And then I've got a membership with a whole bunch of other stuff if people are wanting. Other people, they may stay with just that belly position for weeks. I had a gentleman, Gary Sharp. I'm sharing his name because he shares a lot of our stuff. He has Outthinking Parkinson's is his website, and we're featured on his website as well. It took him months before he could get past the first 3 positions because he was very toxic from all the meds. But now he's like doing amazing with his Parkinson's, and block therapy is one of the major tools that he uses to manage things. So that's the nice thing, is we start connecting to our own bodies. We start learning how to navigate the pace for ourselves. And we have a huge supportive community. I have a private community Facebook group, block therapy community. Everyone is welcome to. We've got tons of support systems, so people have places to reach out. So that, you know, if questions come up, we're here for you, and we give you the specific protocol. So that's the best place to start, is the starter program. But I also have a sampler program, and it's also going to be the free gift for people here, if you want me to mention that right now or not.
Sure, you can go ahead.
Yeah, so it's a smaller version of this, but using a rolled up towel. And a rolled up towel is pretty dense because it's all about the density. So when we teach you how to roll up the towel and use it properly. And you can start today. You can start fascia decompression today using a rolled up towel with the gift that we're going to offer your listeners. And that in itself, unbelievable the changes, because it's not only about the releasing, it's also about understanding how to support now proper postural foundation. And we go through that in that program as well. And then again, when we get to other levels, if people want to follow through to the next step, there's more and more. And we've got daily guided programs. I've got a 90-day trauma program in my membership. So all these different things. I've got a 21-day women's health program, which is lovely because it's also includes work with your hands. And this is a really nice thing actually for people, especially with a hiatal hernia, where you might be scared to, you know, lie on a hard tool, where you're lying on your back and you're using your hands, and I'm guiding you so that you can really start to get through those layers in a kinder, slower way. But it's very profound still, because the hands, when they get on the body and they're slowly moving through those layers, we also can sense and feel those changes under our fingertips. And that's really exciting, especially as well for women that have maybe dense breasts. Like, you know, we teach you, like, start by feeling what they feel like to begin with, and then go through the process and feel them softening. If you have little lumps here and there, feel those melting, you know, under this work. So it's a beautiful process when you really start to connect your hands into your body, and you can feel the changes, you can see the changes visually as well as functionally, and it's fast. For the most part, it's fast. I mean, everybody goes at their own pace, of course, depending on where we're starting from, but teaching people how to breathe. I mean, we were born to breathe diaphragmatically, and we simply haven't been. So that one change is a game changer. We feed the body up to 6 times the oxygen, 6 times. It's crazy.
Yeah.
84% of weight loss, detoxification comes through exhalation. So that whole mechanism, by turning it on, you had mentioned about people with high blood pressure. I mean, even just so simply understanding the mechanical things. If here's my aorta, if I'm sitting this way, I mean, what has that now done to this tunnel? It's compressed it and twisted it. Now my heart has to work that much harder to try to send blood through my body. So now I'm going to be diagnosed with something, high blood pressure, or maybe that compression has caused a valve to not work properly. You know, it's the mechanical aspect is so huge, and we don't give it enough consideration in looking at the body as a whole. If you're in an elevator and you're the only one in the elevator, okay, I feel fine. Suddenly you're in an elevator and 20 people are crowding you, and somebody has really strong perfume and it's causing you to get disrupted, and 2 people are arguing like you're in there and you're like, oh my God, let me out of here. That's what your cells feel like when they're under compression. They're like, oh. So I used to say, I have anxiety. I don't say that anymore. Sometimes I still feel anxious, but if I feel anxious, I recognize my cell is giving me a signal. It's trying to do its job for me, and I'm not giving my cell what it needs to function. So it's letting me know. And if it felt good, I wouldn't change. So pain, anxiety, all of those sensations that come to the surface, those are your cells talking to you. And it's
Hmm.
the baby crying. You know, we wouldn't throw the baby in the corner crying
Yeah,
or
yeah.
crying in the corner. We
Right. So I will definitely have that in the show notes, how people can get your free gift. So thank you, Deanna, for providing that. For our listeners, you can always see when we have it on Spotify, we have it on YouTube, and wherever your favorite platform is, we'll make sure to have those links. But before we leave off, there's a couple other things. I guess there's a lot of people who have, again, if they've gone through a specific type of mesh implant and then a subsequent explant. So there's one that's in between the muscle layers, the retrorectus space, right? And so a lot of people are coming back with a denervated abdominal wall, and that becomes kind of atrophied. That muscle's atrophied and it's very paper thin. And that is my case on the left side, my left flank, paper thin. So would there be any contraindications to using block therapy, or is that where we would modify with the towel? What would be your recommendations?
And that's a very individual answer. So it's interesting because in the very beginning of my journey, before I had even worked with people with a mesh, I had that as a contraindication because I hadn't actually worked with anybody with a mesh at that time. That was 20 years ago. Since then, I have tons and tons of blockers that have mesh that have had no issue whatsoever. But again, it's a process of getting comfortable with adding pressure. So we
Hmm.
can add pressure first with our hands.
Yes.
Then we can also work from a distance to decompress that tissue and make it more comfortable. And then as we keep working and melting those adhesions, the tissue, that blood flow starts to strengthen. So it really depends on where people are starting from and how they feel. And there's always modifications that we can share for people to get to those next steps and do it in a way that they feel safe and comfortable.
Wonderful, wonderful. So thank you again. You provided some information about how people can reach you in YouTube, but if they want more information about your practice, how they can work with you or your team, or how they can register for one of your programs, where would they go?
Blocktherapy.com is the website, and there's a ton of information. And I also have, again, a YouTube video filled with so much free content and many discussions and conversations if people want to dive in to learn more.
Absolutely. So thank you again, Deanna. We appreciate all that you had to offer, everything that all the tips you've shared. I'm going to be practicing that daily, and I'll let you know how it goes.
Thank you so much. And it's been an absolute pleasure, Sharon.
Awesome. So thank you once again, and thank you to our listeners. We'll see you on the next one. Take care.